And staying with health tonight, we look at colorectal cancer. It's the second most common cancer in the UAE, but it's preventable if caught early. And we're joined by Dr. Cecilio Azar, gastroenterology consultant at Clemenceau Medical Center, Dubai. Thanks so much for joining us tonight, Doctor. Now, colorectal cancer is prevalent in the UAE, especially among men. What are the signs of colon cancer, and what are the major risk factors?
Well, let me start by saying, first of all, like any other cancer, colon cancer is a preventable cancer if caught early. And if caught early, it's a curable, not just treatable, but it's a curable cancer. Usually patients, if early stage, they have no symptoms whatsoever. But if it becomes advanced, they might present with abdominal pain. They start seeing some blood in their stools. They start losing weight. And sometimes we can see on blood tests some anemia, some iron deficiency. So these are more symptoms of advanced colorectal cancer. That's why we always advise patients to screen and to look for early detection of colon cancer.
So as you mentioned, I mean, it's difficult to detect in its early stages. There are not frequently many symptoms. When exactly do we need to screen for colon cancer?
Well, we usually advise patients who do not have any family history of colorectal cancer to start screening at 50, and some other authorities actually now reduced the age to 45, because now we're seeing more and more patients at younger ages that have colorectal cancer. So at Clemenceau Medical Center, we advise patients to start at 45 with different modalities of diagnosis.
How do we treat colon cancer? And better yet, how can we prevent colon cancer?
First of all, as I told you earlier on, that if we catch colorectal cancer as early as possible, definitely it's curable. The treatment, usually it's chemotherapy if it's an advanced age, but if it's early age, sometimes during our colonoscopies, we can remove polyps, which are precancerous lesions, and sometimes even early cancers can be removed by colonoscopy. The best so far is surgical removal. Again, I stress on the fact that it should be an early colorectal cancer. And there are different modalities, depends on where's the location of the cancer, whether it's the right colon, the left colon, or the rectum. So it makes a big difference where the location is. But again, better to be safe than sorry and catch it as early as possible.
Absolutely. Tell us a little bit about life expectancy for somebody who is diagnosed with this cancer.
Again, it all depends on the stage. The 5-year survival rate at stage 1 and 2 is almost 80 to 90%. While patients who have colorectal cancer stage 3 and 4, this drops to even less than 20%. So this is why we need to be very vigilant about it.
Absolutely. Thanks so much for joining us, Dr. Cecilio Azar, gastroenterology consultant at Clemenceau Medical Center, Dubai.
Thank you. Thank you very much.